On this biopsy, you can see inflammation that appears to be in the mid-dermis, superficial mid-dermis, but also you'll appreciate some interlobular proliferation, or at least inflammation here in between the adipocytes, and up here as well, you'll notice kind of a degeneration, eosinophilic change in between lobules and in and amongst the fat cells as well. So it looks to be a mixed kind of lobular septal process. It's a little non-specific because you have so much eosinophilic degenerative change here. But let's kind of go to the top and make sure that nothing significant is happening up here. So we have acanthosis and spongiosis of the epidermis, and we have some areas of what look to be proliferation of thick-walled blood vessels, kind of in a lobular arrangement in the upper dermis here. So this is kind of what you see in stasis change. Suggests some chronic venous insufficiency and some overlying spongiotic and acanthotic epidermis. It's kind of like a venous stasis / eczematous process happening here. And you have overlying compact hyperorthokeratosis and intermittent perikeratosis. So that's like an eczematous inflammatory pattern here. But there's something else going on deeper besides just this venous stasis pattern. Down deep here, like we were mentioning, you have a lobular inflammatory process and degenerative process even, where there's a loss of the integrity of these cell walls of the adipocytes, and you're starting to get this really nice, it's a very beautiful pattern that people would call like a snow on a window pane. And that is called lipomembranous change. So this lipomembranous change here, where it looks like ice or snowflakes forming on the outside of a window, this is a type of change that you often see in lipodermatosclerosis. Now, you can see this change in other lobular paniculitides, but the classic scenario is going to be a lipodermatosclerosis. You can see it in lupus profundus or lupus paniculitis as well, but when you have this mix of homogenized eosinophilic change in and amongst the adipocytes with degeneration of the fat lobules, maybe some lipidization of surrounding macrophages, or foamy histiocytes, and then this lipomembranous change with overlying superimposed venous insufficiency changes, your best answer is going to be a lipodermatosclerosis. So those are the major features that you're going to want to look for on a biopsy.